Uh, Now, I'd like to invite Dr. Vinod Kumar Ramalingam, who is a senior lecturer in the Department of Physiotherapy in the Faculty of Physiotherapy and Faculty of Physiotherapy and Life Sciences at INTI International University, Malaysia. He has over 18 years of teaching experience in the field of physiotherapy practice, nationally and internationally. Recently, he and his team won the bronze medal for EOSPE, an innovative ICT-based assessment at the International Invention, Innovation and Design Expo, Innodex 2021 in Malaysia. In the year 2015, he was accredited with outstanding teaching awards, the Professor Emeritus Lee Fa On Award and Teaching Innovation Award by NT International University, Malaysia. He is actively involved in research activities and has worked on research grant from the National Institute of Sports, Malaysia. I welcome you, sir, for this session. The rise is yours, sir.
Yes, very good afternoon, sir, for giving a brief intro about me. So it's audible, sir. Just want to confirm.
Audible, sir. It's audible.
Okay. Thank you very much. Thank you very much. Okay. So good afternoon, ladies and gentlemen. And I thank Saveetha College of Physiotherapy for organizing this wonderful online conference. Actually, Stride 21. Stride is actually a Rombral name. Actually, even when during my college time, I used to participate in Stride. And today I've been very pleasure to share my knowledge in this Stride event. And I thank Dr. Pratap for inviting me and Principal Dr. Jagadishan and also Organizing Secretary Dr. Manikumar. And I'll wish my success to make this event to get success in this upcoming days. And before further ado, and I'd like to share my knowledge about recent advances in neurophysiology of brain and scope for physiotherapists. So there is a quite interesting and explore to gain a knowledge on this topic today. Okay, next slide, please. Okay, so I'm just going to give a brief outline about what is going to happen now. And I'm going to briefly explain about human brain. Actually, my previous speaker has been reduced my effort in introducing a lot of information about this group human brain, because I think she had given a good note about brain's gym. Okay, so there is a good knowledge on from my side also to get a new concept. And now just going to share about a knowledge on recent advances in neurophysiology of the brain and what are the equipments applied commonly in brain signals recording and advances of brain signals recordings and advancements in brain signal recording and the scope for physiotherapy. Okay, next slide, please. Okay, so if you come across a human brain, we all know that it is a central organ in our human body, and it helps in the main functions, let's say like processing and interacting with others and receiving information. So because this all has a good sense what we can able to produce in our community. So additionally, if you talk about brain, it's actually a decision maker center. Okay, so where it decides us what to do and how to do and act. That is very important. And what to think and what to say. So these all will be able to coordinate when we have a good brain function. Next slide, please. Okay, so these are the outline parts of the brain. If you consider the forebrain and midbrain and hindbrain, so these all has unique functions. So for an example, if you take about forebrain, so it is the largest part of the brain, and it includes the cerebrum and and hypothalamus. In that we will be having a right and left. Right now the previous speaker introduced, and thalamus, when you consider it, it is actually a main function center, so which can able to provide our what do you call like it is actually a signal. Yeah, this is actually good for sensory and motor signal processing. And if you take hypothalamus, so it will be maintaining our sleep and body temperatures, and also sometimes hunger. These are all the main functions it will be physiologically it will be doing about. And if you take about midbrain, so it's like it helps in the actually the center of the entire brain, and helps in our hearing sense and vision, body and eye movements especially. Yeah. And the hindbrain, when you look into it, so this is actually, you all know that cerebellum and the pons and medulla oblongata, these all are respiratory centers. So it will be helpful for modulating our breathing patterns and all those things. Yeah, corpus callosum, yeah, especially it will be help to connect the left and right hemispheres, and it has a large quantity of neuro fibers, yeah, neuro bundles, which will connect to get into its functions. Right. Go to the next slide. Okay, so in this picture, you all can able to see about the different regions, yeah, of the brain. Yeah, so if you talk about the cerebral cortex, it is an outermost layer. It is a main, I'd say, like the structure which has its main functions. Let's say like when we have our normal feelings like thoughts, emotions, and attentions, all those things will be get carried out, maintained at this surface level. And if you go to the specific regions, let's say like a frontal lobe, let's say like it will help to maintain our memory and cognitions, and even other, let's say like personality development and emotional traits and social and sexual behaviors and other volunteer movements and speech like that. And if you go for parietal lobe, okay, so it helps in sensory input and discrimination, such as make a person to get judge the shape of an object or size and distance of an object, all those things, right? And occipital, when you consider it, is a visual perception mainly. So it's say like it will be mainly helps in visual interpretation, what we see and how we react. And temporal, it is an auditory, and it's also associated with other human behaviors and receptive speech and informations. Yeah, go to the next slide, please. Okay, so this is about human normal brain functions. Actually, I'm not going in very much detail. I hope you guys has been come across in our normal physiology of it. And when you connect it to neurophysiology of the brain, how it works. Let's say like when you know about a normal physiology of the brain, I say about it helps in our normal process. But here, when you connect it to the neurophysiology, so here it will helps to make because our brain is made of interconnected neurons, where these will help to make us to react. Okay, so I was telling about how it is been acting. So how this has been working? So this has been working as a perception action cycle. So we'll be having a past events, we have a present moment, we'll have a future events. So how we behave? So our behavior will be decided based on the present moment. So how is your brain reacts? So this will be works with the what you call like how the neural functions of the brain works. That's why like we say about how the networks brain interconnected neuron functions. So that will be works of the glia and networks, and it will be like brain's activities. Yeah, so this will be as working about. So when we talk about this will be get steady how we can able to understand the brain functions. So that is mean by a brain signals. So how the signals can be get identified? Okay, so there are different types of signals. Okay, I'll be introducing in the next slide. Okay, and here, so historically, when you look into it, so let's say like neurophysiology, so it can be dominated by electrophysiology. What is that? So it is actually an electrical recording of neurological events ranging from molar. So that means like through by applying an EEG, and a cellular by intracellular properties. And this neuron is actually an electrochemical machine. It is impossible to separate electrical events, yeah, from the biomechanical or molecular process. So that's why even when you go for let's say like testings, so what they do is neurophysiologists use techniques from chemistry, let's say like calcium imaging, and physics like functional magnetic resonance imaging. It's called as an fMRI, and molecular biology, site-directed mutations to study brain functions. Next slide, please. Yeah, you can find here the brain with a lot of let's say like what you call electrical signals. So next slide, please. So we will be having a normal 5 signals. Yeah, so 5 signals. They are called as alpha, okay, beta, delta, theta, and gamma. So if you consider, there are some low frequencies. For an example, theta, delta, and alpha are low frequencies. So this can be get activated during our sleep and also in a relaxed state. Alpha, these all will be get activated. Whereas in the awake state, we will in the current positions, so we all will be having a beta will be activating, and the gamma is see like in threatened and heightened perceptions, it will be get activated. Next slide, please. Okay, so these are all the normal signals of the brain. Okay, where if you consider it, so these normal signals can be get affected. Let's say like in situations where if a person has been get psychologically affected. Okay, so they have a psychological disorder or stress, which is causes that. Even sometimes pain, yeah, it could be an acute or chronic pain that could causes the changes in this brain functions. So we call that as a synchronized brain activity and desynchronized brain activity. So what it happens is it won't have a normal synchronized functions. So there will be a desynchronized. So quick actions might be there or delayed actions might be there. So this will be happens in neurological disorders, let's say like in Parkinson's disease or epilepsy or stroke patients, or in some brain lesions conditions, let's say like tumor or cerebral infarctions. Next slide, please. Okay, so when you consider about this behavior model of pain, when you consider it, let's say like always when you looking into connecting the signs. So the model of signs, what it tells us our perception, let's say like the behavior will be acting based on this actually thoughts and feeling and behavior. So let's say like this is a model of or pain or reactions. So this will be get differs in response to acute problems and chronic problems. So whereas you can see here the left side, so the acute pain says about, so the graph tells about tissue input, let's say like the tissue problem, soft tissue problems, let's say like it will be a larger amount. But whereas the thoughts and emotions is lesser, that means like physical problems are more compared to the psychological problems in this patient's an acute problem. But whereas when you're coming to chronic, so there is actually an emotions and thoughts are fill the large portions, whereas the tissue problem is less. So that means like once a person is having a long-standing problems without healing, so what happens is they will be having a psychological problems in them. So this will affect their behavior. So the thoughts, feelings, and behavior will be different in acute perceptions and chronic perceptions when we receive patients in a physiotherapy setup. Okay, next slide, please. Okay, so we come across, even from the previous speakers, we have understand like there are a lot of outcome measures, let's say like attention scales and stress scales and mood scales, let's say like we can able to use it, and a lot of outcome measures, let's say like for pain as such, we use a visual analog scale and different perception of pain scales will be using out. But these all are subjective. So say like it is subjective to an individual, whereas we in a technology-based environment, so we can able to go out with the tools that is like say like electroencephalogram that is called as EEG, and a magnetoencephalogram that is MEG, and functional magnetic resonance imaging that is called as fMRI. So these are the advanced tools we can use to record the brain, so which will help to know about so how the brain functions, response of the patients, let's say like before the treatments and after treatments, that will be get able to understand. Okay, next slide, please. Okay, so here assessing the brains, which comes out with electrical EEG measures the electrical activity inside the brain, and the MEG that will be a magnetic field that will helps to support to capture the image of the brain, and MRI. So normally we know that, so it helps to detect damaged brain tissues. Let's say like ischemic stroke or any patients, let's say like come out of the brain problems, we can able to study this. Next slide, please. So how if MRI and fMRI differences, because MRI scans the anatomical structures, so whereas a functional MRI capture the metabolic function. So that's what a lot of studies has been studied on how the functional response of the brain has to be get recorded to check whether how that present moment, so how the behavior of the brain is. Okay, next slide, please. Okay, so advancements in MRI, which just makes it to help about, so to understand about the patient's real problem, let's say like a diffusion tension imaging. So it's used to thinking and understand about thinking problems and dementia of a person. So this will kind of, let's say like advancements in technology helps the person to get understand about, so the images of a health difference between the healthy persons and the affected person. Next slide, please. Okay, so here what we can see is functional MRI. So let's say like when there is any visual stimulus, for an example, if a person is being listening to music, or let's say like watching the televisions with what you call like the way of interest they like. Okay, so the brain functions could be ultimately different from the persons those who don't like. For an example, the horror movie, when you watch, the intensity of brain will be differs. So we can able to see some of the colors over here that represents red colors and the blue color. So that will help you to understand about how is the increase in the blood flow to the brain region. Whereas when you put the persons into the visual stimulus, so that will ultimately it will changes the brain functions. So this has been get evidence from the literatures. Okay, thank you. Next slide, please. Okay, so there are some clinical studies has been already reported by having a functional MRI in a case of, let's say, like if a person is having a toothache and compare with the healthy controls to understand about how the brain signal changes on the left post central gyrus or right paracentral. Okay, ultimately all the brain regions where they can able to find there is a response of change in the brain sense. Next slide, please. Okay, so this is actually to know about how the acute stress can affect the brain function, because always humans have a default mode. Our brain will be functioning, let's say like a routine task will be get automatically done. So we call this a DMN, default mode networks. So and whereas salience is actually we have to work with the focus. We are focusing on some task to doing this regular activity and central executions. So normally we will be working about the problem solving, all those things. So our brain has a different functions, executing a different functions based on our what you call like normal functions of our physiological systems. For an example, if there is any acute stress or any altered functions takes place, so this will affect the normal brain functions. So what you call like it will affect the decreased focusing center. So there will be like a connectivity in the brain, and it will affect the normal network of the brain. Next slide, please. Okay, this is a magnetic what do you call a magnetic field encephalogram. So that is help you to get study about the electrical activity of the neurons. So this is like there are a lot of research has been done with the combination of MEG with the MRI. So they will be using the magnetic source imaging. So normally it will be get applied in epileptic patients and to know about the progress of their conditions. Next slide, please. Yeah, this is the brain image to understand about your image of the brain to know about what is being get affected. Yes, next slide, please. Okay, so there are a lot of clinical studies has been using what you call like MEG to get understand about how it affects the brain functions. Let's say like they have done the study to get on the mother and the child when they are exposed to early life stress. Okay, so that affects their alpha band and the theta band in the child. So this has been good, quite differs from I'd say like the age groups. There is a difference in brain waves changes. Let's say like these all affect their low frequency. That means like it will affect their sleep frequencies in the brain signals. Next slide, please. Okay, so the another study has been highlighting about how this magnetic electrical fields will be applied on pain and itch. Something like itch is nothing but it's a somatic sensation. So our body has a very sensitive response for a skin actually. So even if you have any allergic reactions, that will affect the brain functions. So that's what the study has been able to identify. There is a high temporal resolution changes in the brain. So that will ultimately it shows about the brain is very sensitive and it will be get affected in any stimulus. Okay, next slide, please. Yeah, now comes the EEG. So it's actually an electrical device that kept over the scalp to record the electrical activity of the brain. So this is being invented by Hans Berger, and he's a psychiatrist. He is actually he has used to record a human brain functions in the eyes closed and eyes open functions. So he derived a wave called as alpha wave. So and actually is called as a Berger wave. And this electrical activities helps to capture about the low frequency from 8 to 12 hertz times per second. Next slide, please. So this EEG helps in an clinical setting. Advantages gives us easy to get fixed and lightweight and cheaper and having a high temporal resolutions compared to fMRI and MEG. And so this EEG has an advantage with wired EEG and wireless. Actually, say like we can able to go for functional. So that's it, like we can apply in plenty of situations. Let's say like when you want to assess patients, we can able them to go for functional activities, let's say like running, so we can able to assess their brain signals. Next slide, please. Yeah, this is a portable surface EEG to record our brain signals of a person's in their running track. Okay, even now people, let's say like doing running or walking and even meditating, they are using to record their brain signals, and they have small channels to record their brain, and they can able to capture it in their what do you call, like small devices. Yeah, next slide, please. Yeah, this is quite interesting study which shows about how the brain signals has been changed when they listen to the music and to the control. You can see here the bottom, the brain image, topo image has been shows about there is a more activities of the brain. Okay, so sometimes we might be seeing like people will be listening to the music and they'll be doing running or walking. So even sometimes attention might be diverted from their activity, what they do, but the brain activity functions has been increasing. So that includes like music has been stimulating the brain activity. So let's say like when they're interested in listening to that particular situation, yes, almost the brain actions will be high. Next slide, please. Okay, so this helps you to understand about how brain activities has been differs. Let's say like you can see here, a person has been quite sitting for some time, and those are exercising after 20 minutes. So you can see here there is a difference in intensity change in the brain. So that represents, let's say like exercise influences changes in the brain activity. So that can be easily studied by using an EEG. Okay, next slide, please. Okay, even they have brain changes in people, let's say like they go to long Antarctic expeditions. So they have recently found that 9 explorers who spent 14 months in the emptiness of Antarctica. So say like left with slighted small brains. That means like the brain hippocampus size has been changed. So because explorers has decreased in the level of protein. Okay, so that means like 45% decrease from the baselines what they have before going to the Antarctica. So that means like when a brain is being exposed to any stress or events, that means like it will be affected, and we can able to find the changes. Okay, so that's what we can able to understand here. Okay, going to the next slide. Okay, so I just leave it to you after giving out all this information. Okay, so from this, I hope you can able to connect it. And this advancements will help you to understand in the current physiotherapy field, any specialty, irrespective of any specialties, you can think about your own area, and we can explore with advanced tools on studying about the neurophysiology of the brain. So that is very important, and a good scope of area to be explored in recent advances. Thank you.
So it's a wonderful session given by you. There are some questions regarding that. Sir, how MRA is going to help in finding the EEG actions and all? How we are going to correlate with the MRA and EEG? That's the question.
So here EEG, actually these are all the different tools, MEG and EEG and MRI are the 3 different tools. Okay, so these 3 different tools, they study about their brain functions, okay, individually. And we can able to, there are a lot of studies used functional MRI for study their brain functions, and some studies they used fMRI and also EEG, okay, both, and they find the differences, how the brain signals differences. Okay, so but irrespective of any tools, they will be help to record the brain signals, and they will report what is the brain patterns on that particular situations for the particular patients or any person. Actually, even healthy also we can study.
So any study has been done in any stroke patients for this with this EEG and an MRI?
Yes, yes. A
Think
lot of
brain
studies has
affected.
been studies has been done on neurological patients, even chronic pain patients. They have done.
Uh, okay, sir. And sir, is there any correlation with the domination of the brain with this electrical activity seen in persons, even in a normal person, in a functional MRI? Is there any changes in the EEG pattern in dominant hemisphere persons?
Yes,
We will
of course.
say
Yeah, dominant hemispheres. Ultimately, there is a change. Yeah, as like what sir said. Let's say like in patients and healthy. Ultimately, this differ.
sir, later, is there any studies regarding for the elderly patients who is suffering from dementia and other things, sir? Who has
Yeah,
a
there
problem in
are.
memory and all? So that's a great problem for them. What is it outcome with that dementia persons and with the
Yeah,
EEG and other?
they have a lot of studies has been get explored on neurological disorders. Yeah, that includes dementia as well. So if interested, yeah, I'm just encourage you to get encourage the peoples to get work on that. Okay, so to look into that. Yes, yeah, there is a changes in their brain. Their studies has been reported like dementias and other neurological disorders. They have affected with your normal brain signals. Yes.
So the other thing is, whether you have any uh, hands-on experience with the persons with your clinical experience regarding this topic, and so that you can share your clinical knowledge regarding this, so that will be enlightened with this.
Yeah, I'm just working on with EEG on patients with pain and also let's say like sports participants. Okay, I'm just working out and even I already published a paper and also working rightly on different domains. Let's say like even cognitive sciences. I'm just working on with EEG actually. That is my area of interest.
Very interesting to know that, sir. And shall we know if any outcome with that, so that it will be much helpful for us to.
Yeah, there is a good outcomes are there, and I'm not in the situation to report it now. Okay, so just waiting for my papers to come out. Okay,
Oh, okay, okay, sir.
yeah.
Okay,
So
right.
I just yeah, good a good output is a we have a good output from the area where we worked, and hopefully by 1 or 2 months it will be papers or will be released.
So one more thing, any this breathing exercise, other things and all will improve the this EEG activities in the brain. Anything has been recorded in this thing regarding this
Yeah,
in EEG?
yeah, EEG helps to record the brain patterns. Actually, how before the training of any exercises, how the brain functions, and once you apply the exercise and when you record the brain functions, yes, of course, it could be shows different signals, and even after exercises. So let's say like normally we have a fatigue, okay, or post brain let's say like post exercise effect of the brain. So how is the response? Yes, of course, it will be a slight. There are quite challenging informations we can able to gain from this.
Okay, sir. Sir, one more thing, sir. Whether we can able to improve the brain activity with the yoga and other things, all that. That's
Yeah,
so.
there are yoga and other lot of cognitive therapies has been get applied this EEG as an what you call like in their exercises. Yeah, to study their brain functions. There are a lot of studies has been get published in a good journals about this. Yeah.
Recently, I heard one of the mutra, it is Linga Mutra, which we will usually see in this thing, sir. It is, will say that if you keep this here and I think your brain will be activated and it increases your breathing pattern and all. I heard in one of the researchers have done that, and it has been telecasted in the TV and all regarding the outcome with the Lingamutra. Have you, is it so the same thing has happened that is quite true with that, or anything else if you have?
Yeah, of course. Any practice, let's say like whatever the practice we are doing, let's say like, of course, it could come under the control of our brain function actually. So this will ultimately, they will change the brain signal actually, ultimately change the brain signal. So we cannot say like how it depends on a person actually, that individual person. So when we know about the particular person's brain response, it's like when they, before starting the exercise or doing any, let's say like as Sir mentioned, actually if there is a Lingamutra, when they are doing it, so that time what is the brain response, we can able to understand that. Yes, post when they do how long, and compare with those who are not did this Lingamutra and those who are not doing, and we can able to compare that. Yes, we can able to find the difference.
Sir, quite interesting, sir, your research and your thing and all that. Very pleased to know that all that information from your side, sir. It's very
Sure. We'll be have a continuous connecting. Okay,
okay,
so
sir.
with Saveetha University, so we'll be able to update it.
Okay, sir. Thank you, sir. Thanks a lot for coming for this session and sharing your knowledge in this part of this thing regarding EEG and your and this MRI pattern and all. Thank you, sir. Thanks a lot. Thank you, sir.
Thank you, sir. Thank you for attention.
Okay, sir.